Get ready to invest in yourself and elevate your expertise with the Perio School podcast, brought to you by Perio School. It's Dr. Reena here, and you're joining us for a new monthly show where we'll be providing the latest case studies, first-hand insights, and interviews with our global dental network. Plus, we'll enable you to experience exclusive behind-the-scenes highlights straight from our global portfolio of courses. Let's get started. This season of the Perio School podcast is sponsored by Colgate. Register on Colgate's professional education hub to access all professional and patient resources, including your one-stop shop for all verifiable ECPD. Visit www.colgateprofessional.co.uk today to sign up and register. In this masterclass, we're going to be talking about treatment planning, and we've obviously spoken about the new classification. The other guideline was this treatment planning guideline, the S3 guidelines that were released by the EFP and the BSP. So this was more recently updated, and I'd say the first thing to be aware of is that we've got an update in terminology. So instead of saying things like scaling and root surface debridement, we now say PMPR, which is professional mechanical plaque removal. And it's either supragingival PMPR or subgingival PMPR, and that's it. That's the kind of terminology we use now, which is great. It's more simplified, and I would definitely update your notes on that. Now, when we're talking about treatment planning, there are 4 key steps in periodontal treatment planning and a treatment plan for our patients. So the first one is supragingival PMPR and risk factor control. So this is all about establishing a solid foundation for our patients. As we know, unless we get the risk factors under control and they're brushing well and everything else is under control where we can, the treatment's not going to work. So that is our first and most important step. And actually, this step is pretty much repeated throughout your treatment plan. Once they're engaged, you go on to step 2, which is subgingival PMPR. And subgingival PMPR, as we used to call it, root surface debridement. And the current guidelines basically suggest that this can be done in sort of any way that you like with you and your patient. You can do it in 1 appointment, 2 appointments, 4 appointments. But the main thing that the patient is engaged, otherwise it's not going to work. And how do we measure engagement? Well, it's a 50% or more improvement in plaque and marginal bleeding scores, or plaque levels of less than or equal to 20% and bleeding levels of less than or equal to 30%. So make sure they're engaged. Decide how you'd like to do the sub-PMPR in terms of number of appointments and whether you're going to do half mouth, quadrant by quadrant. And then also, think about the instruments you're using. According to the new guidelines, you can kind of use hand-powered or both. So in practice, I actually like to use a sandwich approach. So I use both hand and ultrasonic, and we also have the airflow, so that fits in nicely. So in terms of order, I would start off with the airflow, then ultrasonics, then hand, then back to ultrasonics, and then back to airflow. And that seems to work really well. In the guidelines as well, it also goes through about what other kind of agents can be used and other techniques and technology. It actually suggests that lasers are not used as an adjunct. And there's a big thing now, especially with patients coming and say, I want to use the laser. But actually, there is no evidence to suggest this is superior to our traditional instruments. So I would argue, why would we then use the laser? Why would we then charge our patients for the laser? There's no need. Stick to what works, sticks to evidence-based practice. It also suggests that photodynamic therapy is not evidence-based, is not enough good evidence to suggest that we use this in practice. What you might want to consider are adjuncts like antibiotics, adjuncts like mouthwashes. But again, be case selective. For antibiotics, it's usually the sort of grade C susceptible patients that you want to consider. In our practice here, obviously, we're seeing a cohort of sort of severe periodontitis patients. We do tend to use a fair amount of antibiotics just because of the type of patients we see. I'd say my favorite one is azithromycin, just because the compliance is really easy. It's only 500 milligrams once a day for 3 days. So compared to something like Amoxin Metro, the compliance is much better. So we tend to use that. And it's always on the last session. So if you're doing half mouth approach, it's going to be on your second session, the last session. It tends to work well. So we've done step 1, done step 2. Step 3 is essentially you then reassessing your patient. I generally wait 2 months. You can wait 3 months. You redo the pocket chart, see how much improvement you've got. If you've still got open pockets, you may then need to do further non-surgical. You may then also consider referral for further non-surgical or surgery. So that's step 3, which you may or may not be involved in. And then the final step for every single perio patient, which is absolutely key to mention from the beginning, is supportive periodontal care. In fact, I would argue there's no point doing any of the other treatment if the patient is then not happy to have long-term or lifelong supportive periodontal care. Otherwise, your results won't last. So there's a waste of time and money for you and your patients. So SPC, inform the patient about this right from the beginning so it's not a surprise to them. Explain that periodontitis, gum disease can't be cured. It's something that can just be stabilized, a little bit like diabetes, and you just need to keep on top of it. So frequency in terms of the new guidelines of SPC depends on the patient. It's all about risk now. We're really assessing the patient's risk to determine the interval. But it's anywhere between 3 months and 12 months. And also it needs to be dynamic. So depending on what the patient's going through, if they're going through a really stressful period, they haven't been, on top of their home care, they're stressed, their diabetes out of control, you might want to see them more often. If they're very, very good and everything's under control, you can extend your interval. So it's really, really dynamic and risk dependent. In the guidelines as well, it's worth reading the paper. They also go through all the latest evidence base on all the oral hygiene techniques within step 4, but obviously this is relevant to the whole plan. So a typical plan, for a perio patient would be something like, number 1, discuss the importance of diabetes control or smoking or any other risk factors. Next step would be oral hygiene instructions, and you actually detail what you're going to go through. The next step, you'd probably do a full pocket chart, and then you do your full mouth supra PMPR, followed by sub PMPR of probing depths 4 millimeters with bleeding or 5 millimeters and above. You reassess 8 weeks later, further treatment planning, and then lifelong supportive periodontal care. So I think it's worth checking the latest guidelines, making sure you're following the new terminology so that we're giving our patients the best evidence-based approach so we can get the most optimal results. So on this episode of the Perio School podcast and this segment, we have a very special referrer joining us today, Dr. Yasmin Saeed, who's been a friend of our referrer network for many, many years now. Yasmin, welcome to the podcast.
Thank you, Reena, for having me. I really appreciate it. Thank you.
It's been so great to follow your journey over the last few years and everything you're up to. It's super inspiring. So tell us a little bit more about yourself, your background, where you're based.
Sweet. So my name is Yasmin Saeed. I'm a dentist who graduated from Sheffield about 6 years ago. Worked my way through kind of hospital-based environment and then finally onto general practice. Found my niche really in oral surgery and implants, and that's kind of what I've stuck to. And that's kind of why I started referring to Reena, just for general practice cases, but also getting the green light before any big implant cases.
And how did you become aware of why perio is so important and you do need to refer? Because I find often when you're an undergrad, like you're not really taught when to refer, how to make the most of multidisciplinary care. So how did you educate yourself on that? Because you're really, really good at it and you always send the right style of patients.
Thank you so much. Well, I think dental school often is very textbook. You're taught in a certain way. But I also was aware of the fact that perio is highly litigated, and so I wanted to also like medico legally do the right thing for my patients. And I think as dentists we know that we're not going to be able to help and treat every single patient, and there are some patients that would benefit from specialist input, and they're kind of the patients who have really good oral hygiene but have other risk factors or underlying kind of genetic factors, or BPs of 4s and they're super young, they've got vertical bone loss, etc.
Yeah, makes sense. Are there any particular cases that you've sent across that you were surprised with the results? Or because sometimes I feel like people think perio doesn't work, and I definitely, as an undergrad, I actually like perio. Don't know if many people know that I didn't like perio at the beginning.
Yeah,
I just thought this is such a waste of time until I was doing things properly. So sometimes people are like, no point
yes,
referring to perio; it's not going to work. Let's just crack on with the treatment. Any case examples of
true.
where you're surprisingly actually this is a really good outcome?
No, absolutely. So there's definitely one patient that stands out that I think I show his before and after, like x-rays and photos to some of my patients. He's quite a young patient, presented with BPs of 4s everywhere, vertical bone knee defects around his 6s, and he's seen you, I think, for a couple of rounds of treatment and at the reassessment, I've got a PA where like a vertical defect on a lower right six has had bony infill in it, and it's just like it makes the people who don't believe. Like I was like, oh my God, like I'm so happy for him, and fantastic love from you guys.
Yeah, no, that's one of the things that recently there's a big push on MINST, so minimally invasive
Yeah,
non-surgical therapy, where again, not a lot of people know about it, but it's a way where non-surgically we can get bony
yeah,
regrowth in vertical defects without doing surgery. So
yeah,
I have to say, I can't actually remember the last time I picked up a scalpel for periodontitis cases.
yeah,
Often, and patients will ask you what we will do different, and I guess the answer is,
yeah.
specialist techniques,
That's true.
specialist equipment to really get things under control. We've trained just to treat patients like that for many, many years. And it's great to see
Yeah,
what we can do now with Perio. The only time I pick up a scalpel now is for like management of recession, surgical recession, or crown
yeah.
lengthening cases. So um,
Yeah, no, absolutely. And but also, I think you guys give the patients the time as well, the time to spend on OH, and I think that's super important because if they're not motivated and the OH is not good, like their response to treatment is not going to be as good. And unfortunately, in 15 minutes for a checkup, there's only so much that you could do, I
completely,
guess.
I completely think that treating perio sometimes in general practice is it's difficult. It's sometimes not worth it. Like you've
Yep,
got to make an executive decision and do the best for the patient
yep,
for sure. Do you feel like
yeah.
referring has strengthened your trust with patients? Because I think sometimes dentists or hygienists might feel, oh, I'm referring out, I'm going to lose that relationship with the patient. How do you feel like that's affected you?
I think if anything, I think the patients, like especially when they were working on a big case, and I'm like, you know what, actually, I'd prefer if you had at least one round of perio before, say, we plan for this implant, and I see the patients on a reviews appointments or for the CBCT or whatever, and when they go to your place, the feedback I get is like they feel special, right? They feel like I think highly of them, and I have referred them to this place where they get an amazing care, really, really thorough, and they feel like they're kind of no, I would say yeah, like treating themselves essentially, like looking after themselves. And your follow-up protocol is super neat. Like I don't have to worry about the perio review. Like it's just great. I love it.
Amazing. No, that's so good to hear. Do you have any tips for if from what you've learned from Perio School and referrer
Mhm.
events that we do, are there any bits of Perio that sort of surprised you or you've learned that you think have benefited your everyday practice?
Yes, I think definitely the first one is if you're not sure, just refer and refer early rather than when the patient's got like 20%, bone like bone left at the apex. But also I think I went to your most recent event about perio and occlusion, and I loved that topic because you see it so much in general practice, and yet it's kind of like, okay, let's do some, see the hygienist and maybe have a mouth guard, but it's just not as simple as that.
Exactly.
I see lots of like cracked tooth syndrome and things like that. And there are also perio defects around those teeth that I think I wouldn't feel comfortable making a prognosis decision. I'm just going to leave it in you guys' hands. And I feel confident in you guys that you'll be able to give me like a good prognosis on things. So,
Yeah, amazing. And so you're doing a lot of implant treatment now. How's that all going?
yes, it's going good. I've got a fantastic mentor with me as well. I just also again with the perio thing, I've seen when implants fail miserably with implantitis, periomplantitis. So I want to know that my patients with the implants, it's a lifelong management, and they need to know they have good OH. And I like that you guys can take care of them, and I don't have to worry about, am I using the right scaler tip? Am I doing the right thing? So it's
It's
great.
surprising how many patients think an implant is literally just a screw, so they don't need to even brush
Yep.
it. They,
Yep.
I don't. I mean, if you had no dental knowledge, I'd probably think the same. You just think, oh, it's a screw, it's not alive. You
Yeah.
don't need to. But actually, we really need to educate our patients that implants need more
Hmm.
care than teeth.
Yeah.
So I think it's an important point to emphasize. Some things that are obvious to us might
Absolutely.
not be so obvious to a patient. So uh,
No, 100%. Yeah. And it's a slippery slope between like perimucositis and then
yes,
periimplantitis. Like things move very quickly.
completely.
So yeah,
We've got to be on it. I think a lot of people
absolutely.
still not confident with assessing implants, probing implants, but I think it's a
Yep.
skill that everyone has
Yep.
to learn. Even if you just put a diagnosis of peri-implant disease and then refer on, the indemnity organization suggests
Yes.
as long as you're checking it and referring it, that's the key thing. But what we mustn't do is ignore it because, as you said, progression is
Absolutely.
rapid and medically it's
Yeah,
so
100%. Absolutely. But I think as undergrads, we're like, oh, it's an implant outside my scope.
yes,
I can't touch
yes,
it. So
yes, not
yeah.
true, exactly. Listen, Yasmin, I know you're back to back with patients, so thank you so much for your
Yes, thank you so
time.
much.
Great to get an insight, and
Thank you.
I'm sure we'll see you soon. Thank you again.
Absolutely. Thank you for looking after my patients.
Perfect.
See you later.
Hi, Dr. Sophia from Perio School here. So we are just wrapping up our Hygienist course, and we had 2 days of hands-ons and theory. This is something you want to do if you want to upskill and provide the best outcomes for your patients. But anyway, let's hear from our delegates what they have to say and whether they enjoyed the course.
So my name's Danielle, I'm a dental hygienist. So I decided to come on the course just to refresh my skills really. Just to get better in practice at what I do and just update your knowledge. Reena's really good at delivering as well. She's a really good teacher. I found it really useful. Just taking a lot away from it. Things that you don't think about in your day-to-day like practice. There's just so many little things that she makes you think about that you wouldn't normally. So just how to deal with patients, especially nervous patients, and how to treatment plan, things like that, rather than just trying to fit it all in one appointment. It's easier to spread it out.
My name's Kizel. I'm a dental hygienist and therapist. I've been qualified for 15 years now. Yeah, it's generally my background, yeah. Working currently, 2 practices, predominantly private practices. And I came onto the course because I wanted to just, make sure I'm staying up to date with my skills, just reignite my fire for reason why I started out in this profession. And it's really helped actually, yeah. I think the one biggest thing is obviously one, it's a really sort of, it's a small group. So actually it makes a really big difference when you can get one-to-one, just a chance to talk to people, a chance to talk to Dr. Reena as well. When you're doing instrumentation, ultrasonics, just to, check your technique, etc. It's so much easier in a smaller group. And actually she's got a distinct style of teaching, which I really actually found, it's refreshing, it's different. And so I think I can take away a lot from this course. I would definitely recommend this course, yes. Thank you.
Hello, I am Anna. I'm a dental hygienist and a therapist. I'm newly qualified in the UK, and next week I will start working in a dental practice. And I was very lucky starting and doing this 2-day course here because I enhanced my knowledges. I now feel more comfortable on talking on patients and providing treatments and solving their dental problems. So I feel more confident, and this became gradually every hour learning more things or just refreshing the things that I knew before. And that makes me feel different. Definitely recommend to all new qualified and even experienced hygienists.
Welcome to today's episode, where we're joined by Dr. Paul Midha, a trailblazing cosmetic dentist, entrepreneur, and former finalist on the BBC's The Apprentice. After graduating as a dentist, Paul poured everything he had into acquiring his first dental practice. Through 15 months of unwavering dedication, he grew that practice to a staggering 900,000 valuation. That was an exceptional 5-fold increase and his biggest business success to date. Beyond dentistry, his rare blend of discipline and creativity landed him a role as an extra on a Disney TV show.
Oh yeah, I forgot about that.
In this episode, we dive into the mindset and everyday habits behind his success. Paul, very excited to have you here. A huge welcome to the Perio School podcast.
Reena, I must say that was an amazing introduction. I don't think I've ever been gassed up like that, but you know what? It's an honor to be here. You know how much respect I have for you and what you've done for periodontics as well. So to be sat here doing a podcast with you, the honor is all mine for sure.
Oh, thank you so much. We're going to get going, and these are quick fire questions. We're being nosy. We're asking about your day, your behind the scenes. So we'll start off from the beginning. So how do you start your day? What would you say is a non-negotiable in the morning?
Non-negotiable for me, well, apart from brushing our teeth, of course. Non-negotiable for me is I always have a particular type of breakfast. So I have avocado and toast and one boiled egg, and that just sets me up for the rest of the day. Then I know I'm not going to go too hungry during the morning session, let's say.
So that keeps you fueled up during the morning. And is there anything that's always like stocked in your fridge? If we opened your fridge today, something that's always there?
Do you know what? I don't know if this is a weird one, but Actimel. So I always like having a little bit of Actimel. So that's always stocked in the fridge. Every day I have it without fail. I just feel like it sorts me out. Even if it's placebo, it just sorts me out. So.
And if we said what's one item you absolutely can't live without, what would you say that is?
Well, I mean, within dentistry, especially my loops. Like I couldn't work without my loops at all. So I think even to the point, if I didn't have it, I would actually cancel my day.
Wow. I think, to be honest, I would do the same. It's like you can't see anymore.
I know, literally. I tried it once and I was like, I don't know what's going on. It's like a different form of dentistry.
Okay, coffee or tea, and how do you take it?
So one thing about me is I have a very low tolerance to caffeine. So like if I have a coffee after 2 p.m., I won't sleep that night. So I would say coffee and I would say a latte, but I have to have it before 2 p.m. Otherwise, I'll be, But what happens with me is I like really come up from it, like get a lot of energy. Then I also crash from it as well. So I try to avoid it.
So you just have like one a day. You don't kind of...
I mean, not even one a day. I say like only when I'm doing something like really big or important will I have it. That's how much it affects me.
Well, it's not a bad thing, reducing calories.
I wish I could be a regular coffee drinker.
And what's your, so you told us about your avocado toast in the morning. What about lunch? Like what's your go-to? Because you're obviously doing so much, running your practice, doing other things. What's your kind of go-to, especially when you're in a rush?
Okay, I have a confession to make. I'm probably not the best at cooking and I'm not the best at eating healthy. So what I do is Simmer Eats. I don't know if you've heard of it. It's a meal prep company. Yes. So I have that for lunch every day, and that's just quick, put it in the microwave, eat, and then I know I've got the right relatively right nutrients to set myself up for lunch.
Nice, brilliant. And obviously you've done so much already in your career, from The Apprentice to everything else. What would you say is your career highlight to date? Is there anything that's been your favorite? I mean, it's probably hard to pick.
There's a lot. I think from going, I would say two things. So I think it was about 2019 or 2020 when Jin and Kish gave me the go ahead to kind of teach on one of their courses. Yeah. And I remember how nervous I was the night before, and I was confident I was going to pull it off. But the first time you're about to teach is just it's always been a significant moment to me. And of course, I've got to say, coming third on The Apprentice was I changed my life completely. Literally, it's never been the same since. In the best of ways possible. Amazing.
What were you teaching for Jin and Smile Academy? What topic?
Yes, so the first ever one I taught was photography. And I remember there's actually a funny story behind it because I used to use a Surface Pro, which is like the mic, but the presentation and everything was on Keynote. So I remember trying to load it up and it wouldn't load up.
Oh, no.
I had to borrow Jin's laptop. And I had to use it for the whole day. He wasn't very happy about it, and he was like, "Go get a MacBook."
No. I love those guys. So much respect for them. Everything they're doing is absolutely brilliant.
Mentor for like 8 years now, and best mentors for sure.
And how do you stay motivated? Because every time I see you, whether it's in person, online, you're always like full of energy, looking really fresh. What keeps you motivated every single day?
Do you know what? I think for myself, I have this calendar app, right? Basically, I organize everything. And I also have organized like days off, like chill days where I literally do nothing. Nice. I just like binge watch a whole Netflix. So I've got a special talent. I can binge watch a whole season in one day where I just completely shut down. So I'm either at like 0% or 100%. There's no in between for me. So, but I think those rest days, a bit like a battery, enable me to kind of be recharged when I need to be.
So you actually schedule those in as well, not.
Yeah. So one of my mates goes, "Oh, do you want to do something?" And I'm like, no, it's my rest day.
Right. So rest is literally fully resting, not even going out and
nothing. Literally switch off. It's usually like on a Sunday or once every 2 weeks, just to completely reflect and switch off and recharge.
And you feel that's made a good difference to your energy levels generally day to day?
Oh, 100%. A game changer for me because It's also because if you start doing too much, what happens is you start to get ill, you just get really tired, you're not performing, and it's not fair for those things that you've promised. Especially, what it's like in clinic. I always say every patient that comes in, you might see like 10 to 15 patients a day, but they're only seeing you. So
Correct.
I always treat it like a performance, and you always want to be given 100%.
I completely agree. And treat your last patient like your first patient.
Yeah, exactly.
If you could swap lives with anyone for a day, who would it be?
Oh, an interesting one. So I think it would be a footballer.
Okay.
I would love to see obviously they've got so much pressure on them, but to come out to like a crowd of people and perform on the biggest stage of all would be probably something that I'd want to do. I'm not going to lie, I don't think I'd ever make it as a professional, but it's a nice way of maybe switching for one day.
I can definitely see you as a footballer.
I don't think I'd do very well. I probably end up not in non-league or something, but it would be a cool experience.
And what's one thing people would be surprised to learn about you that we might not really know?
One thing that people would be I'm actually quite a lazy person, believe it or not. So yeah. So I again, and I said when I switch off, I fully switch off. So I think people only ever see me when I'm like doing something, or I'm at this, doing that.
Yes.
But behind that, when I'm recharging, especially, I'm just completely switched off. So I think one advice I'll give to people: you can't be on all the time. Take some time out for yourself as well, and I really value that highly.
Completely agree. And it's really good advice. And sometimes people find out when it's too late and they're burnt out and they're like, okay, now I need to make some changes. But completely right. And I don't know how much of a tech guy you are, but what's one gadget, app, or tool that's kind of genuinely changed how you work? You mentioned your calendar, obviously, but anything else?
Well, definitely my calendars app. Like that was because what it is color coded. It gives me reminders, so then I know I can organize everything to a T. So I'm a hyper organized.
Is it a specific?
It's called calendars, but it's changed everything for me because every event is color coded. It sets reminders, so that way I know I'm not double booking, or I know like, okay, from this time I need to be here, especially going across different cities and different countries and things like that. So and especially because I work 4 days a week clinically as well, to make sure nothing overlaps. So I know it's too much.
That's too much. Gosh, with all you're doing, that's a lot.
It's too much. But I love clinical dentistry. Like I love it. It's like my passion. So I would never want to kind of take away from that, from anything I do.
Definitely. And what's your dream holiday destination? If you were to book something next, what would be the one that you'd love to go to, or you already go to, or you go to regularly?
Okay, well, my dream is to see the pyramids. Like, I'd love to see the pyramids in Egypt. Like, I'm fascinated behind, like ancient civilizations and how that all came about. So to go to South America, or Egypt, as I mentioned, I would love to do more kind of traveling in that way and just see the world. So that would be my thing. I think sometimes we go on like relaxing holidays, your typical Spain, Dubai type of places. Yeah. I love to go exploring as well.
Love it. And I've got 2 more questions for you. One of my favorite questions that we ask all of our guests is, what's your favorite quote or like personal motto that you live by?
So this is a quote: "Who are we to judge? Our boat is still out at sea."
Nice.
You might come across someone in, maybe not so good of a situation, and you might judge them for it or whatever, but you don't know what they've been through. You've never been in their shoes. So I always say, help as many people as you can. Don't judge anyone, because you literally don't know their backstory.
Absolutely. And you don't know where your boat is going either. So
because you could end up in the same or an even worse place. So it's important never to judge.
For sure. I think just being kind to people underestimate the importance and the strength of it as well. So that was really nice. My final question, because time's nearly up, is what are you most looking forward to? What else is coming out next? Anything that's not confidential, that what can we look forward to seeing in your journey?
Yeah, I mean, obviously about the practices and my journey with Smile Dental Academy and everything, but I'm actually in developing an app, which again I can't say too much on, but it will be getting released hopefully either next year or the year after, where essentially it's to help reduce medical tourism and really make everything a lot more streamlined, but also bring the whole dental community together. Again, I won't talk too much on it because of like NDAs and all that, but it's definitely a passion project of mine. And I think if it does well, it'll do really well. Or if it won't go anywhere, then it obviously won't go anywhere. But it's worth a go.
Well, that sounds impressive and I think well needed, to be honest. So
I think there's definitely a gap because the ultimate aim is to decrease NHS waiting times as well, because it's such a huge problem. And there's such a lack of consent for medical tourism, where hopefully it can help reduce even the fatalities that are happening there. So, and the effect that has on people's families. So hopefully it will do well.
Well, good luck with it. Keep us up to date. Paul, such an inspiring conversation. Thank you so much I know you're super busy in between projects, etc. So thanks for giving up your time. And we look forward to seeing you again soon.
Reena, honestly, it's been an absolute pleasure. Thank you for having me. And again, it's always an honor to talk with you. And, hopefully we can do more things in the future together.
Absolutely. Thank you.
Thank you.
This season of the Perio School podcast is sponsored by Colgate. Register on Colgate's professional education hub to access all professional and patient resources, including your one-stop shop for all verifiable ECPD. Visit www.colgateprofessional.co.uk today to sign up and register.